set up in case someone wants to hear it later and doesn't get to hear it today. So we have Charlie Francis, who is CSG's Justice Center program manager, and Thomas Coyne, who's got his video off, but some of you may recognize his name because Thomas and I have been working with many of you over a number of years now on housing for Stepping Up Ohio. He's going to be managing all the technical things about this. And depending upon how many folks we have here, let's see. So we got some more that are still joining. So I think we were debating, depending upon how many were joining, whether we'd have you all introduce yourselves. But why don't we wait until the discussion Q&A part, if that's okay with you, Charlie?
I think so.
Okay. One last thing, I just want to acknowledge PEG's Foundation. As many of you know, they've been so generous to us around Stepping Up Ohio work, and they are underwriting these webinars. Okay, it's you.
All right, thank you so much, Sally. And yes, we definitely really appreciate the support of PEG's Foundation to help us be able to do this work. Yes, so my name is Charlie Francis. I'm a project manager with the Council of State Governments Justice Center. And for those of you who may not know who we are a national organization in the criminal justice field that combines the advantages of a 50 state bipartisan membership association of all 3 branches of government with a criminal justice think tank really focused on solutions to research and training based solutions to the field to help make the system more efficient and more effective, but also, especially what we're talking about today, my division, behavioral health, really focuses on strategies to connect people with the appropriate care and supports, including and especially housing, to help keep them out of the system and minimize the amount of time they spend there in the first place. So we are, we are not nationally in focus, but we also work intensively to support some folks like Stepping Up Ohio who are doing some really great work on the ground. So really happy to be with you today and talk about some of these exciting new programs. Next slide. So our agenda today, we'll be talking about the Emergency Housing Voucher Program, one of the first of several key programs that we will focus on as part of the American Rescue Plan Act. So now that we've completed our welcome, I'll give you a brief overview of the American Rescue Plan Act, otherwise known as ARP, and a global view of the housing funding that's been available. And today we're going to zero in on one program, the Emergency Housing Voucher Program, which is a real critical resource to address the experience, folks who are experiencing homelessness and how that has really been exacerbated by the COVID pandemic. So after I go through that material, we're really excited to have a nice, productive and open discussion and Q&A session to dig into these things a little bit further. Sally's going to lead that for us, and we can really focus on what this looks like in Ohio. So next slide. And then so on the next slide, we have an overview of what the American Rescue Plan Act is. I think everyone probably knows that it is a almost $2 trillion spending package designed to really jumpstart the economy and help households that have been affected by the pandemic. And it's exciting because there's a significant carve out of housing resources as part of that. There's more than $12 billion dedicated to development, rental assistance, and supportive services. And so the second part is what we'll be talking about today. And it's really a rare opportunity. We all know that housing is one of the biggest pain points for those of us who are trying to help keep people out of the justice system. And this is really a rare opportunity to be able to set aside some dedicated resources to make these connections to housing. So we're really looking forward to talking through that today and giving you an idea of what this really great opportunity looks like. So on the next slide, you will see And something that I'm going to come back to again and again today is that this is a really important opportunity, but time is of the essence. Even though this is a significant increase in rental assistance resources, as well as resources for housing development, it's important to get to the table with your local housing partners, your local housing authority, your local continuum of care, to really have some focused conversations about what your priorities are for using this funding to support people in the justice system. And in particular, there are a lot of demands on this funding. There are a lot of vulnerable people that need housing, people who are chronically homeless, people who've experienced domestic violence, so forth and so on. But what we're really going to talk about today is some strategies for finding that mutual buy-in to be able to serve the stepping up population, in particular folks who are really cycling through a lot of public systems, not only jails, but emergency rooms and shelters, and a population for really whom criminal justice, housing, and behavioral health, it's a lot of the same people, and we all kind of have the same mission to be able to serve them with housing resources. Now, I just want to mention, we're not going to be focusing on this, but ARP also has a number of additional housing resources available, including emergency rental assistance provided both through HUD and the Treasury, which is really focused on preventing people from losing their housing and can be an important real homeless prevention strategy. There's also significant resources set aside for rural housing assistance, housing counseling, and emergency food and shelter. So at the end, I'll point you towards some resources that the Justice Center has put out that goes into that in more detail if you're interested. All right, so next slide. So today's focus, the EHV, Emergency Housing Voucher Program. Nationally, this is $5 billion allocated via formula by HUD to local housing authorities. And what that means in Ohio, specifically to the dozen to 20 or so housing authorities that will be receiving this funding, it's 1,522 new housing choice vouchers available to serve a number of vulnerable populations, including our stepping up population. And so these are targeted towards people who are currently experiencing homelessness or at risk of homelessness. And in particular, that at-risk category is what we want to focus on because there's a real opportunity to set aside some resources for our folks. And so the lion's share of this money goes towards providing the rental assistance itself. And it's a Section 8 housing choice voucher. So it's a permanent subsidy. There are time limits to when you can issue the initial allocation of vouchers, but once the family has that voucher, it stays with that family. So it's permanent housing. And there's a major supportive services component as well. The housing authorities receive a flat fee for each person they assist to help design a supportive services program. And it can include key things like housing search, really, which we know can be really, really difficult, especially with the limited inventory out there and the barriers that people face in the justice system, outreach to owners, assistance with moving costs and security deposits. And then this is also coupled with the larger menu of supportive services coordinated through the Continuum of Care, which I will talk about a little bit more. So now that you've got a brief overview of this program, we're going to talk a little bit more in depth about some strategic considerations about what you should be looking at as you prepare to have conversation with your local housing authority. So if we go to the next slide. And then actually the one after that, sorry. This is a really unique program, especially in the housing choice voucher world. Normally, a housing authority has pretty wide discretion to decide who gets vouchers off of their waiting list. What's different about this program is that it is a required collaboration between the housing authority and the local continuum of care. And for those of you who maybe are not familiar with the continuum of care, the majority of homeless assistance, federal homeless assistance funding nationwide is allocated through HUD. And the way HUD does that is through these COCs. It's a local level body that is typically there's a lead agency that's often either a housing agency or a homeless coalition or something of that nature. And the COC receives the funding each year from HUD, and they decide, they undertake local planning and prioritization activities to really prioritize, okay, here are the folks who are experiencing or at risk of homelessness in our community. Here's how we're going to prioritize that funding. And then here are the different housing projects or ongoing supportive services that we're going to support through that funding. And so they decide kind of the different housing projects that are supported, but then also they operate what's called a coordinated entry system, which is a unified system where if someone is experiencing or at risk of homelessness, they can go to a shelter, a local housing provider, maybe even a hospital, or sometimes even if they're in prison or jail, and have an intake assessment done looking at their housing and other behavioral health needs, and they get prioritized in sort of a master scheme in the community, so that when a slot opens up in a COC supported housing program, there's a unified community-wide decision about who gets that slot. So just a little bit about what COC and coordinated entry means, because it's really critical for the EHV program. So the critical and time-sensitive piece of this is that the COC and the local housing authority need to enter into an MOU to decide how these vouchers get distributed. And so that MOU has to be executed by the last day of July 31st. And so a number of things in the MOU are say, the goals of this program, how it will be administered. But for this group, the most important thing to know is that in that MOU, you can specifically specify which subset of the population experiencing or at risk of homelessness you're going to serve. So that could be directly people exiting a correctional institution. It could be people who have been cycling through different public systems. There's really a lot of latitude there that you may not normally see in HUD programs. So that's why it's really critically important to build relationships with the COC and the PHA so that we're all thinking about this at the same time before that critical deadline. So next slide, please. And so how does this prioritization and referral work? So like I said on the last slide, one of the most critical things you want to take away from this program allows you to set aside either all the vouchers or a certain number of vouchers for a population such as stepping up. And another interesting feature of this program is normally PHAs have a wide latitude to set their screening criteria related to criminal background. They still do to some extent, but a big change is that they're not allowed to just automatically deny somebody due to drug-related criminal activity. And we know that because of the population that we serve, a lot of them have become involved with the justice system for this reason, often due to addiction and behavioral health issues. So that's definitely a big win for our population. And so generally the referrals to fill these EHV slots need to come through that coordinated entry system. Ideally, though, they're in the MOU, it's specifying which folks are prioritized. Sometimes it can be a challenging conversation with the COC because HUD's conventional definition of homelessness can sometimes make it challenging to prioritize people who have been incarcerated for a long time, over 90 days. There are some conversations that you may need to have with the COC to change those standards, but it's, that can get a bit technical, and I'd be happy to answer more questions about that. But it's basically just want to say that it's not an insurmountable goal, even though sometimes it can seem that way. And in particular, if you're having a conversation with your local COC or your PHA, and even if there may not be the local buy-in or the capacity to focus on people who've been involved with the justice system, the fact is, stepping up often overlaps a lot of other priority populations, people with high behavioral health needs, people who are chronically, not chronically homeless necessarily, but who have experienced homelessness multiple times. I think sometimes there can be a sense that there are all these different competing groups to be able to be served. with housing resources, but the reality is, and I think everyone on this call probably knows, that it tends to be a lot of the same people. So that can be a really good strategy for establishing buy-in as well. All right, so next slide. And so just a little bit more, the next slide has a little bit more detail on the actual categories themselves of how people can qualify as homelessness or at risk of homelessness under this program. You know, the first category is people who are literally homeless. That's exactly what it sounds like. Either people who are unsheltered, living in a place that's not fit for human habitation, in an actual homeless shelter, or exiting an institution where they've been for less than 90 days. The second category is the one again, I want to keep driving this point home that we want to focus on. People who are at imminent risk of homelessness. And this includes a number of definitions, including people who are couch surfing, people who are going to be losing their housing within a certain amount of time. Looking like we have some real variety. Some folks very familiar and working together. Some that are most people seem familiar, but sort of the level of working together looks like it varies here. Just give this another 30 seconds or so for those last couple of answers before we close the poll. And I pass it back to Sally. All right, thank you so much. And I believe our discussion section is next, if I'm not wrong.
Certainly. Thanks, Charlie. That was really informative and interesting, and always things just start popping up in my head, especially the poll answers. So I was trying to totally understand the poll answers, but it didn't surprise me that a lot of folks don't have relationships with their local public housing authority, or what we always refer to as a PHA. They have traditionally in lots of communities worked kind of doing their own thing and following a lot of rules and requirements from HUD on how they distribute their resources of vouchers, or even utilize their own public housing stock, which again is even changing. Charlie used the term at one point, unique, that this is a unique opportunity. I want to stress that. And what strikes me about this unique opportunity of these emergency housing vouchers is I think it's probably throwing a lot of the local public housing authorities in a tizzy. They are so rule-based. They are so, they get audited frequently by HUD, by inspector generals. They can get dinged when they fall outside the rules. And this program for these emergency housing vouchers has just like opened up opportunities really wide. There's a number of waivers now around all those rules. And I am sure that housing authorities are grappling with what the heck does this mean for how we do business. But the couple highlights I want to stress about it is that this opportunity requires really strong partnerships with those homeless continuum of cares and other partners. They always throw in and other partners during any of the training that HUD's doing on this. And to me, you all are the and partners. And there's going to be some data sharing things going on too, that again, I think you bring some specialized information, knowledge, experience to the table. And that the one, Charlie also mentioned the support services piece. This is really unique to this particular program. They're putting $3,500, HUD is putting $3,500 on the table per voucher. And how a local housing authority decides to use those in partnership with the homeless continuum of care and other partners can be very, again, unique to getting folks leased up quickly. So that's part of the thing, is that the that this is supposed to be done quickly to get people into housing, with lowering a lot of the barriers that we see happen to stepping up folks. So I wanted to emphasize that too. And I have observed the years now that I have worked on the Stepping Up initiative with a number of you closely and with PEG's foundation support, is that we sometimes defer to these other systems and don't realize how good we are about what we do in the criminal justice world. That I'm just encouraging you to speak up, to call up, to email, to find out what's going on if you're not already intimately involved in what is happening right now. So those are kind of my overall thoughts. So why don't we, if you don't mind, Thomas, let's drop the slides for right now, just so I can see people, because we've got a fairly small group on the call. And if you guys don't mind, if any of you have a question, why don't you go ahead and unmute yourself if you're muted, and put on your camera so we can see your pretty faces. And let's just start with some questions and a discussion.
Sally?
Yes.
Hi, Sally. It's Mary Gillette.
Mary Gillette, how are you?
I'm very good. How are you?
I'm good. Nice to see you. Mary, tell people who you are.
I'm with the Veterans Justice Outreach at the VA. And we've got a number of initiatives too that are going to fit nicely with this. And we have a number of veterans treatment courts, as well as in Delaware. We have one in Marion. We have one in, or actually two in Columbus. And we're starting up another initiative in Luken County. So we're expanding. And this is a great project to where we can provide some case management, assist veterans that are criminally involved in seeking treatment and or getting medical treatment. You know, many of them haven't even had any access to medical treatment. So I'm really excited. But my question, Sally, is that I know that from when we started way back, one of the big issues was sex offenders. Are we going to be able to house any sex offenders yet?
So there's some, I think Thomas will maybe be able to share a link for one of the HUD webinars that was just held to talk a little bit more about the waivers on the criminal justice. They are still restricting lifetime sex offenders, and if somebody manufactured or sold meth on federally assisted housing land, those are still no way. But there's all these other things that they've basically gotten rid of. They've given some optional things to PHAs, but that has to be negotiated with the homeless continuum of care. But those two mandatory restrictions are still in place.
Yeah,
lifetime.
I know the other thing that's been a real bump is anybody with 5 years of a felony.
So that's been waived. So that's one of the waves. So I don't know if you're going to be able to put that. Did you put that in the chat there, Thomas? Or I know you were having some technical difficulties, but that particular webinar, it's recorded. The slides are on HUD's website. You can even quickly go through it to get to that section that talks about the waivers on criminal justice. So I encourage you to look at that.
Great. Thank
And
you.
we do also had, so you mentioned like a gazillion counties that you do veterans justice outreach in. And we do have a spreadsheet that I put together. So just so you know, not all of these vouchers are in every single county in Ohio. Thomas, can you pop that particular spreadsheet up? And at least this way, those of you that are on the call, you can look to see if your county's even listed. So how about another question while we're waiting for Thomas to put that up?
Sally, I have a question on a similar line.
So
of what
introduce yourself.
Oh, I'm sorry.
Diane.
I'm Diane Alacusen. I am at CareSource. I am the housing strategy lead for the state of Ohio for CareSource. I've been here for about 2 months. I was at the Ohio Housing Finance Agency for about 4.5 years. So
Great connections.
Yeah. So working statewide as we do, I know that only certain PHAs got and accepted the vouchers. Is there, for organizations like us who are kind of on the periphery, is there any kind of centralized place that we can find, you know, the list of not only the MHAs that accepted the vouchers, but also what COCs they're working with, and maybe even what, you know, priority populations that they've selected?
So a couple things. So I don't know. So I just know the PHAs that were offered. I don't know if anything's been published yet about who actually accepted them. I would be really shocked, given the list of ones that we have in Ohio, that they did not accept them. And then in terms of the COCs, I only put on this spreadsheet. So Thomas, are you able to pull it up? Says you shared a file, but I don't see it on my screen. Do I have to do something to see it? Are you guys seeing it? A spreadsheet? Okay, we're not seeing it. So I put on this spreadsheet the homeless point in time count numbers for each of those COCs. Several of those housing authorities, okay, so there we go. So several of these housing authorities are in the balance of state. So the way Ohio's continuums of care, homeless there's, we have 88 counties. There's 80 counties that are all in the balance of state, which is run by Cohio. They have an enormous website that talks all about their continuums of care. And then the other ones are the major metropolitan areas. So if you want to scan down through here, and maybe in your case, Diane, look for the counties where most of your members are. And then tell me how, you know, who you want a connection with. I can help you make those connections if that will help this population. Does that make sense?
Yeah, that sounds great. Thank you.
Okay. Does anybody have any questions about this spreadsheet now that it's up while we're just, before we take another question? So I just wanted to point out, I put on here purpose. Okay, go ahead. I've heard somebody.
It's Dan Obertan. Sally, how are you?
Hi, Dan. Tell people who you are, Dan.
Of course, Dan Obertan. So I work for the Jefferson County Adamus Board in Steubenville. Okay, so of course Jefferson County is not on here, so that means we ain't got no vouchers, correct?
This particular allotment, but I hope that you will stay tuned, because this is just one in a series of webinars. We're going to talk about the money that's going to be available for development of new units, and that is more widespread in Ohio.
And did I also hear you say that the authorities could be offered it but could choose to opt out though?
Yeah, so I'm gonna pick on Adams. So let's say Adams didn't take the 15 vouchers. The way that I understand that it's gonna work is that HUD will keep those vouchers in the state of Ohio, but then offer them to another housing authority. Now, whether they offer them to these same ones or ones that never got an offer to begin with, that I'm not real sure. Charlie, do you know the answer to that?
Yeah, they I'd have to look back and double check, but it will definitely be reallocated to a different housing authority. But there's a whole, the HUD field office has some discretion to establish that. And I could definitely answer that in a follow-up question, but it's at HUD's discretion, but I just have to look back at the exact rule there.
Yeah, and if you even look at Adams, it's kind of interesting to me that they got 15 vouchers because, you know, that's a fairly small county. And according to the point in time numbers, they didn't even have chronically homeless folks in their point in time. And they didn't have any folks in their homeless numbers that had serious and persistent mental illness. So I'll follow up though and find out if we can find out how many of them actually took.
And I can contribute to that question.
Okay.
I'm just enough to be dangerous. Hi,
Okay.
everyone. I'm Sonia Nelson. I'm Vice President of Resident Initiatives at Columbus Metropolitan Housing Authority. I do not manage the voucher program. We have a VP of Housing Choice Vouchers program that manages that part. So we did get quite a few of the emergency vouchers. From my understanding, we have to use a certain, everyone that has been allocated them has to use a certain amount of them. And then once you use that certain amount, you can go back and ask for additional if the state has them. And so, but you have to demonstrate that you could use the ones that that you actually received first before you can go back and ask for more. And we don't get all of the vouchers at once. So we only get, it's given to us in a phased approach. So again, to make sure that we could utilize them instead of just holding them and not being able to use them during the time.
Oh, that's great to know. So your housing authority got almost 300 according to this chart, but you actually aren't getting all 300 in one lump sum. It's a phased in approach.
Right.
Okay, that's great to know. Thank you for
I
sharing.
also have the answer to the previous question too, because it's my understanding that, you know, there's no statewide agency, you know, administering vouchers for the balance of state. So what would happen is that the vouchers would be prorated by, say Adams doesn't take their 15. Hopefully they will, because we love Adams. But you know, those 15 vouchers will be prorated among the rest of the housing authorities in the state based on HUD's determined need.
Great. Okay, thanks. How about another question?
Hi, Sally. It's Ariel from Lorain County. And to
Hi.
everyone else, I work with the Mars board in Lorain County. I'm kind of unique, and Sally knows this. I wear a number of hats. So I actually serve newly as a COC co-chair. I work with Stepping Up as a co-chair, and I work with all of our homeless and homelessness and housing in the county. So I'm kind of intertwined through all these systems. So I guess, you know, I've been in a couple of meetings with Ohio and the COC for these vouchers. So we are starting to plan and work on MOU. But in terms of stepping up, I just wonder, I know that Stepping Up Ohio is talking about a landlord risk mitigation fund pilot possibly this year. Is it something that we can offer if our local COC and PHA will add Stepping Up to that MOU as a priority population?
Great question. So for those of you that don't know about this, we've been working on it for 3 years because we recognize that the stepping up population can be riskier tenants. An example I gave to an insurance agent that I just talked to the other day, because I'm doing some work on this, you know, somebody could have unknowingly and didn't realize that they just set fire on their stove. And now there's damage to the kitchen. We don't want a landlord to be penalized for taking a risk of renting to someone that might have some psychotic breaks. So what is happening, what is good news, is the OFA, the Ohio Housing Finance Agency, the Ohio Department of Mental Health and Addiction Services, and our Ohio Department of Rehab and Corrections, they're putting a little money in it, They have agreed to partner with us to create a new landlord risk mitigation fund pilot just for stepping up counties. And what it will do is it will offer kind of an insurance program for landlords who are willing to rent to the stepping up population. And we're working out the details. I'm actually drafting the RFP. The Department of Mental Health and Addiction Services, OMAS, is going to administer it. The idea is to launch it before the end of the summer. And so we won't have it in place and know for sure who's going to be in the pilot. There could be 5 to 10 stepping up counties. We have 51 stepping up counties in Ohio. So it's a smaller portion than everybody, but I would encourage you to let your partners locally know that this could be an opportunity, because quite frankly, if you, Ariel, if Lorain County applied to be in the Landlord Risk Mitigation Fund, and in your application, you said, we got the Housing Authority and the local Continuum of Care to put the stepping up population as a priority in our MOU, I can guarantee you that would look, that we would look very favorably on you being a part of the pilot with that kind of language in an MOU.
That makes sense. Thanks, Sally.
Yeah, thank you.
Can I just mention something as well?
Yeah, please.
Just while we still have this chart up, I know, Sally, we talked about this a little. I think one thing, if some of you maybe are preparing to have a conversation with your COC in particular, you know, COCs are very focused on serving folks who are experiencing chronic homelessness, as they should be. You know, that's what HUD requires them to do. It's an important mission. You know, so it is possible you could get some pushback that, you know, we would love to help, but, you know, we need to focus on more chronically homeless people. But if you look at, say, Akron, for example, you know, we have 99 EHVs here, and then based on the latest numbers, 44 people identified as chronically homeless. You know, this is far from perfect, but it's a very, very rough cut showing, you know, there is, if you remember before, I was talking about the different categories of eligibility, you know, literally homeless and then at risk of homelessness, which is where a lot of our folks would fall. There is most likely some room to prioritize these folks without pushing out other folks, even if they are higher acuity. So it's, you know, I wouldn't like go showing them, you know, print out this chart or anything, but it's just good to know that we're growing the pie enough that there should be room for COCs to go beyond kind of the people that they most typically serve.
Yeah, and I want to stress that too. Again, my experience is we don't always come to the table with those kinds of good arguments. And as many of you know, we did this business case modeling on a gentleman in Delaware. His cycling cost the public hundreds of thousands of dollars that was unnecessary if he had been put in housing with lots of supports like he was eventually after 8 years of cycling. And I'm working on a case now for Ross County. So you all have these. And so they're touching lots of public systems, and that's costing money. And I think that's another good argument to take to the table when you go to advocate that this population be added to the priority list. So Thomas, I think you probably could take that down from the screen now again, so I can just see people's faces in case we got more questions.
I would just add one of the things where I think that there are definitely some opportunities to prioritize just the justice involved and able to get a voucher. The one thing that I get concerned about is being able to actually use it. And so once as a member, as a staff of a housing authority, just for those that already receive vouchers from us, it's 30% are not successful at connecting it to a unit. And from my understanding, that is like a national average. And so housing authorities anticipate 30% of everyone that is awarded a voucher would not be able to find a place due to whatever restrictions or whatever. And so that is with the current background and look back policies that aren't incorporated with the waivers that are with the emergency vouchers. And so I'm concerned about the connection between the landlords and finding places that you could be able to actually use the voucher. You might be able to get one, but that criminal record history still might jeopardize that person being able to use it with to be eligible for that lease. And so
I have a couple thoughts about that. And I totally agree. So for example, I worked with NAMI. We raised money and set up a landlord incentive fund for people with serious mental illness coming out of psychiatric hospitalization and mental health rehab in Southeastern Ohio and 21 counties in Appalachia. And it was still tough. We put $1,000 on the table for any new landlord. An existing landlord, it was $500. And then if the person was successful in staying housed for a year, the landlord could get either another 1,000 or another 500. And the providers in the community set a couple challenges. And one of them was landlords were still expecting monthly income at 2 or 3 times the rent to even be considered. And the other was just the lack of units, right? We have that chronic issue everywhere in the country, including here in Ohio. We just don't have enough rental units. So I thought there was a couple things about this particular program, and maybe Charlie can weigh in on this, that I thought might help. One is they're allowing you all to take longer to allow somebody to find a unit. So usually you have to cut somebody off if they haven't found a unit within a certain amount of time. So that's been extended. And they're also, and again, I think every housing authority in negotiations with their partners, local partners on these, will have to look at this. They're allowing higher rents to be paid on a unit if that's a way to get somebody into housing. So there could be a heavier subsidy, and all of the flexibility on income verification there's just so many things that are waived and are much more flexible. The other is, in this state, we still have some of these landlord incentive funds operational. Like Cuyahoga County has their own. Cohio put out $100,000 to their counties in the balance of state for landlord incentives. And someone in Licking County recently told me that Cohio is looking at taking some of that money back and redistributing it because some people aren't using it. I don't know why they're not using it, but they aren't. And then we still have some of this landlord incentive money in Southeastern Ohio that hasn't been spent. And that $3,500 that is going to be on the table for vouchers as support services. In one of the HUD webinars, they had Orange County, California talk about the things that they actually started to do last year, even before these emergency housing vouchers were in place, to try to get more folks that were long-term homeless and homeless into housing rapidly with vouchers. And they actually tested out some of these things. I guess they must have gotten waivers from HUD to be able to do that with their regular vouchers. And they said that they are really happy about this $3,500 because they think that's going to make a big difference too, because it'll help. It could help pay a deposit. It could help pay first month's rent. It can be used in different ways now, with the idea that they want to get these folks into housing quickly. And then my big issue is the support services. So we did a survey of the Stepping Up counties as to who really would have capacity and interest in this landlord risk mitigation fund. And I asked in the surveys, of all these kinds of services that are in, that could be available to somebody with mental health issues, which ones do you have? A lot of counties in this state have 6 to 11 various ways that they can support somebody with mental illness. But are they working as a team to like surround somebody? That's what they did in Delaware with Brent, who was costing hundreds of thousands of dollars before they got him into housing. Brent had a team, I have said this to a number of you, Brent had a team of 20 people to begin with. And it included the fire chief because Brent had been a fire starter. Some of those people peeled off of the team as time went on because Brent got stable and he got successful in housing. So I think if we can bring some of those things to a landlord, maybe we'll be a little more successful. I don't know, Sonia. That's my hope.
I definitely encourage to continue the conversation. I think Franklin County is very progressive. I myself I got connected to this webinar because I serve as the secretary of the Franklin County Reentry Advisory Board, and I chair the Housing Committee. So, but yes, there's a lot. So I make as a recommendation for one of the things that you mentioned, Sally, was the landlords requesting still 2 to 3 times the amount of rent. So in Columbus, we have a source of income discrimination act. I think that goes into effect, I think in July. And so that means that 3 times rent is not, having an income of 3 times the rent for a voucher holder is they only need to have 3 times the amount of the tenant portion of their rent. And it is illegal if somebody is discriminated because they do not meet the income requirement. So if you wanted to look at that legislation and use it as an example for something that you want to promote in your city, that is going to really help, at least from an income perspective.
Yeah. Can you find a link for that and share it? I live in the city of Columbus and I didn't even realize that that was happening. The state of Washington passed a state law that's very similar. That a landlord couldn't discriminate against someone for their source of income. So, if you're on Social Security and that's all you've got, you're poor. So I'd love to see that legislation, and it certainly is something we can share as a resource. Speaking of resources.
Yeah, I think it's time to get to the resources.
Okay.
Put those slides back up so we can finish up. We have a number of resources to share with you all to really support these collaborative efforts. And by the way, thank you for a great discussion. These are always my favorite part of these webinars, to hear your questions and to learn about the great work that you're doing. Because I always learn a number of things as well. So the resource we want to point you towards most is, if you want to learn more about ARP, the Justice Center on our website, we've put out 8 sort of mini briefs on the different funding opportunities that are available, not only in housing. One of these bottom left corner can take a deeper dive into some of these other housing funding sources that we're not going to talk about, but also, healthcare, education, more public safety related funding. There's really a lot there that you can dig into. And again, we'll be sharing all of these slides so you can get these links. And on the next slide, what else do we have? Some real basics. I think, most of you at least know who your Continuum of Care is, but you might not know who the lead agency is or the contacts. So HUD has a grantee contact page where you can look up what's called the collaborative applicant, which is HUD's term basically for the COC leader. And that's really who you need. If you need to know who to be getting in touch with to have these conversations, this is where you go. And the great thing is, if you miss these slides or forget, this is pretty easy to Google. Just look for HUD COC contacts and you'll find it. And then on the next slide, I'm going to go through these quickly because we'll be posting these for you later on. The resources available for state and local rental assistance, direct to tenants to sort of prevent people from becoming homeless. That's not something we're going to focus on, but here we have a link here to the database of emergency rental assistance programs in different states. So if you wanted to dig more into that. And then next slide, we'll have some more links for you if you want to get a little bit wonky with it and learn more about kind of the ins and outs of each of these programs. In particular, the EHV is a complex program. It's a simple idea, complex in implementation, like all good federal programs. So for that and these other programs, we have links to the notices where you can really dive deeper. And then, what do we have next? Our next webinar, what Sonia was just talking about, is a really good segue into our next topic. Today we were talking about rental assistance, which is very important, but ultimately there's just not enough dang housing out there for anybody, especially for our folks. So HUD has also set aside a number of additional funding. HUD actually and the Treasury Department have set aside funding resources to really be able to develop units focused on this population. So really excited to present our next webinar. It'll be during this lunchtime slot again, Thursday, January 15th. We'll follow up. I think Sally, Stepping Up folks have already sent out a save the date, and we'll follow up with a link and more information. And if you go to the next slide, I'll just give you a little teaser as to what we'll be talking about. There's two main sources of development funding. There's the direct HUD funding, called the part of the Home Partnerships Program, that can be used for a number of things, including construction of new, affordable, and supportive housing units. And then the Treasury also has a much larger program that's not just dedicated to housing. It's dedicated to all sorts of business, household, and fiscal recovery uses, but it sets aside in their guidance that this funding can be specifically used for housing development and other services. So we're really going to dig into these two sources, but again, people are already lining up. These are generally through state and local governments are receiving this funding through formula, and they're dictating how this will be used. So we're going to do this next webinar. We're doing it sooner rather than later because this is another key opportunity where we want to get to the table and have these conversations, and strike while the iron is hot. I think that's the last slide. Do we have anything else? No, just thank you again. You got mine and Sally's emails up here. If you have additional questions, I would love to answer any questions you have or provide any assistance I can. And I know Sally will do the same. I just really want to thank you for joining us today and for a great discussion. And Sally, I'll give it to you for a final word.
That's all. Thanks, everybody. I really appreciate it. I learned too. And thanks again to Peg's Foundation for making this possible. We'll hopefully see you all in July.
Yes.
Thank you.
Thank you,
Okay.
everyone.
Bye-bye.